Welcome to the Bonded Podcast Foundation Series, hosted by Dr. Patty and Lizzie Shutt,
where we explore attachment healing and the bonds that shape us as children, as adults, and as parents.
We talk about the joy, the complexity, and the challenges that come with forming deep human connection.
From before conception through early childhood and far beyond.
Whether you're expecting, adopting, navigating loss, or supporting someone you love,
or simply wanting to better understand yourself and the ways your early experiences still impact you today,
these conversations are for you.
The podcast isn't just about raising secure children.
It's about healing ourselves, breaking generational cycles, and creating relationships rooted in safety, trust, and authenticity.
You'll hear from experts and parents alike on topics like fertility and perinatal loss,
adoption, returning to work,
temperaments,
identity shifts, and the emotional realities that often go unspoken.
So settle in,
take a breath,
and know that wherever you are on this journey, you're not alone.
You are not alone.
Hi, everyone. This is Dr. Patty, your host of the Bonded Podcast. Today, I'll be alone welcoming Dr. Joelle Taylor, a fertility specialist who's right here in my backyard in South Florida. So welcome, Dr. Taylor.
Thank you so much, Dr. Patty, for having me. I'm so excited for our conversation.
I know we've been talking about this for a few months, and I'm kind of excited to get into this, especially with you. I just love chatting with you and hearing really your perspective and just hearing a little bit about how your practice, the way in which you practice, has evolved over the years. I'm super excited to share with everyone. And I do want to say, Dr. Taylor's here with us today to really talk about some different things. This isn't medical advice. So if you're someone who's, struggling with getting pregnant or you're undergoing IVF or any of that, this is really like a different side to it. So this is more of like the relational and some of those aspects, the non-clinical. So just want to kind of make that a point and also to really recognize that today we're looking at fertility through the lens of attachment theory. So for people listening, and I know we have spoken about it a bit about, what our approach is and what we're kind of curious about, how it impacts different things, but about those relational bonds that a person has developed in childhood and has carried forward in their life and are now showing up in your office. So maybe we'll just start there is just this sense of now practicing after so many years. I imagine that first consult, you can begin to get a feel for who's in your office and even sort of what's presenting besides the lab reports.
Of course. No, it is very interesting. And you and I have spent countless hours talking about those things. And while I may not be able to put a title to, to the attachment, if you will, I definitely can sense different energies from different patients as they present to me, whether it be, fear or anxiety or sadness and depression. There are, a wide range of emotions that come into my office, and both men and women. I think as I always tell patients, it takes two to tango, and I see both the male and the female as my patients, and try to invite both of them to really open up and have meaningful conversation with me. And it's such an intimate relationship that we build, and it's quite beautiful. I think the science is amazing in the fertility world. It's just amazing, but I think there is no field in medicine like fertility, because it's something so personal, so private, and couples bring it into our small little office space and share so much, or at least I try to invite them to share as much as they can so that so I can best serve them.
Yes, I think that's really what's so special about you and why you're the person I send people to, because you really are approaching it from that really kind of sacred space of recognizing that, this couple is coming to you for help with this very intimate thing. And right away, you're already prepared and honoring and okay really with whatever's coming in the room, whether it be grief because of lost pregnancies that are coming in, or difficulty and or the fear and anxiety. So that sense of that you're already ready and waiting for that, and not just looking at the clinical kind of side of things. So I love that. And you mentioned, I love also, just as I heard you say, that men and women, they're both, you consider them both your patients. And we could even expand this, because I'm not sure, I haven't asked you this question, if you have had same sex couples come in. So is that also a part of your practice?
Absolutely.
So, yeah. Yeah.
Yes. Same-sex couples, single parents by choice, where it's whether it be a male or a female who are seeking, growing a family,
Mhm.
or heterosexual couples,
Yep.
and kind of everything in between.
Yeah.
But, whether it's someone coming in alone or with a partner, I really try to, well, I really just try to be very inclusive. So
Mhm.
whether a partner is coming in to kind of actively participate in the
Mhm.
fertilization, if you will,
Yeah.
or just being a support person, they're
Mhm.
still very much a part of the process, the emotional process, the
Mhm.
support, um, the day-to-day struggles. And I try to honor that
Yeah.
as well.
Yeah, I love that. And I'm sure you see really all kinds, because everyone's different, right? When I think about even attachment styles, personalities, even people's, their belief systems, their spiritual beliefs, their cultural heritage. There's so many things that sort of get brought into naturally the birth process, growing a family, what a family means. There's so much there. I know that in this brief podcast, it maybe isn't going to be possible to speak to it all, but I really want to make, maybe this will be the future of some of our other podcasts, is to maybe get down into more intimate with, whether it be same sex or a single person coming in to grow their family. Because I think those might also offer some other kinds of deep inquiry and curiosity, and even for us to
Yes.
support that for people, because that's really what we're about, right? We're about really growing healthy attachments, and not making it like it has to look like this in order to be healthy, secure attachment. And so here we are.
Yes.
You're growing so many families out there. I love it. I love
Mhm.
it. Oh man.
So,
So I'm curious about, and so now this is going to be one of those things that I understand as a psychologist very, very much, that in our culture we might see men and women as different, and they are.
mhm.
They
Mhm.
are. There are
Yes.
some real differences, and there's a lot of similarities, and there's a lot of ways in which a relationship, a couple, a man may come in and be more of a nurturing, sensitive, emotional, and the woman is more, pragmatic,
Mhm.
and which might seem different than our stereotype. Okay, but I've seen it. I've seen
Mhm.
it. I see it in
Mhm.
my office all the time. And then the stereotypical woman is more emotional, man is more practical and wants to like fix or solve the problem, and more rational, less emotional, that
Mhm.
sort of thing. So I want to kind of name that might be what we consider, it's like stereotypical, and yet it isn't how it always is.
Couldn't agree more. What's very interesting, and that's where I guess the psychology would come in, but I can't say that in my um, 15 years of practice that I've seen people necessarily on the same page. It almost seems like couples come in and one is the more pragmatic
Mhm.
and one is the more emotional. I'm really kind of, thinking about this and trying to think through if they, not really, it usually seems like what, but I would tell you that I think just as often as I see a very sensitive woman, I see sensitive men.
Yeah.
I think more common than a lot of people might realize.
Mhm.
Um, and and I think in some situations it could almost be a little off-putting. And I think it's really important. And I oftentimes just chat with my staff, my nurses, my medical assistants, and remind them that, just because a woman is more pragmatic, it
Mhm.
doesn't necessarily mean that she is less interested in the process, not not struggling as much. Um, and, likewise, when a male comes in and they're the more pragmatic, sometimes their frustration comes out a little bit more as anger or
Mhm.
like they're, but again, that reminder that they're also struggling on some
Mhm.
level, and it may be grief, but being masked by anger. And so it's always just this reminder that at the core, there is this heartache of infertility, and that's what brings them into the office. But how they express that, there's so much variability, and we
Oh my
can't put
God.
people in.
I just, what you just spoke is so, so, so important. And first, I just want to really honor you for educating your staff and the reminding them, right? Because we can forget, we can sort of get in a routine of doing things, and then in walks, someone who's behaving a little different. And for sure, there's a tendency for men, but I think also women. I'm one of those women who, when I become afraid, fear activates anger in me. I react. I'm going to appear more angry, like I'm angry, but I'm actually afraid. And so that's for me. And I know that that's a very masculine kind of thing that we see
Mhm.
out in our culture. So recognizing that anger is not, even if it's frustration with the process and disappointment and, finding fault, ultimately it's grounded in something deeper like grief or fear or
Mm.
sadness and disappointment or whatever those other kind of things that are flowing right then. And so I love even that you spoke to how, because this is such a huge cultural thing that I work with, even myself, because I share a lot about how my own personality can be off-putting to people. I'm generally super happy Patty, generally, like, and then when I'm not and I'm angry, anger is not, for women, it's really not acceptable still. And so when I get angry, like, people definitely get afraid of that. Okay. So
Mhm.
so I hear a lot, they're afraid of me. And usually it is like my fear or some kind of protective thing where I'm angry almost always when my anger strikes. It's because I'm attempting to somehow protect someone or something. And it doesn't really help though, because then people are afraid of me. I mean, I guess like, if we look at this like from a survival perspective, it might help, but really in the clinic or in this like clinical kind of setting, it's generally not helpful. But you're able to step in and really hold that true deep understanding that all these feelings are really coming from a desperate place, a wish, a desire to have a child, to grow a family, and how really precious that is. Yeah, my mind is very visual, so I imagine people coming into your office for the first time, right? And just what that must be like. And I'm curious about when you take in a couple for the very first time, right? I imagine they're in lots of situations, right? You might have referred from another doctor, or, sometimes people come in with probably all their lab work and
Mhm.
maybe other information, and then some come in with nothing. They're starting just from the beginning.
Yes.
Yeah.
Yeah, it's interesting because I think that when I have a couple who comes in, couple or individual, or just someone who's coming in for infertility, and I'm saying infertility because different than fertility preservation. A woman coming in to freeze her eggs, totally different
Uh-huh.
energy, a totally different experience, and that could be a podcast in and of itself,
Okay.
because I think that is so different than either individuals or couples coming in with infertility as the underlying reason for their initial visit. And when an infertile couple comes in, when they come in with nothing, I'm their first stop. Admittedly, it is, to me, I kind of like that. I think that they haven't been bogged down with the process, if I'm being honest.
Yes.
They haven't gone deep into the deep dark web of, Dr. Google, and tried to, it spent a lot of time kind of swirling in that space. It's usually, I think, a lot easier to just kind of start the conversation, recognize they've for some period of time been trying to conceive, whether it's 6 months, whether it's a year, whether it's a month. It doesn't really matter, whatever brought them to me. And we kind of thoughtfully go through their history. And I always say that, the first visit is very much me just trying to get to know them, what brings them in, what their life is like outside of my clinic. And, again, it's our initial consults are, they're scheduled for 45 minutes, but they could take an hour and a half. I really never rush the process. I always tell my patients, if you're waiting today, it's because someone needed a little extra time. And if you need a little extra time the next day, someone else is going to wait. And I think that there is, I really try to allow patients the time and space that they need to kind of open up to me, so I can get a kind of a big picture idea of what's been going on in their life outside of the office. We order tests, and then we follow up, and then that's where we kind of go through the data, if you will. Well, I see this, and and then make treatment recommendations. But that first visit's wildly important to just get an understanding of why they're there. And even that, again, I'm not making clinical diagnoses. Someone's anxious, someone's depressed, but it does give me a feeling, if you will. And we can chat about it later, but I do practice medicine very much intuitively. I years of experience and lots of education, and I am up to date on the literature and have the data in my brain. But at the end of the day, there's different ways to do things. And oftentimes I rely on my gut feeling and kind of our next steps. And so it's really important for me to really just kind of get to know what they're like. Everything from what they do for a living to, you know, their family, their goals, their, social habits, their exercise routine, how they sleep at night. And while they're important medically, they're also really important, I think, psychologically to the process. And so we spend a lot of time there. Again, a patient who's done nothing and comes in, it's a nice kind of easy starting point. But at the same time, patients who have maybe been through treatment elsewhere and are very fed up with the process, or frustrated, or really kind of down and out with their infertility, that's even a different conversation and a different kind of get to know you session, if you will. Um, but all equally important. At first visit, just very, very important to kind of get to know the situation.
Well, absolutely. Just hearing you again, your patients are blessed to have you, because what you're really sharing with our audience is how much you use really all ways of knowing, not just medical, that when we tap into our wise mind, that's what I call that intuitive part of us that can integrate all of that medical information, all of the knowledge, the science, the current literature, all of that's there, plus this sense of knowing humans and how complex we are. Okay, that there is a whole system. There's a system in the body. There's also a system around us. So the relational system, which is what I do as a psychologist, I'm a relational therapist. Not a relationship therapist. So I don't do couples, but I'm a relational in that it is in the relational field. Okay. There is change and an impact always on everyone as we move about in the world, as we move into a partnership or we, go to work and work with a team. There's a whole relational field. And that is a powerful, powerful field. So you're describing how literally you give yourself time
Mhm.
to almost enter the field. Okay. I mean, you didn't call it that, but that's what
Yes.
I would call it. Okay. You're like,
Yes.
I just need time. And sometimes it takes a while
Yes.
to really, I mean, based on couples, based on how open they are, how settled they might be in the process of just opening to you, that you might need more time to enter into that field, to be able to intuitively be able to not just give them a clinical next step, but that there's so much to this, right? And we're not actually talking about necessarily the science of it today.
Mhm.
Yeah.
Yes.
Thank you so much for separating the infertility from the fertility, because I really love that as another episode and how cool that is about
Yes.
yeah. So people coming in and how different that is for you. I can also see how much you love what you do.
Oh,
It's
yes.
really coming through. Like I've always seen it when I've spoken to you before, and we've had conversations. I mean, you light up, and I really love that. Yeah.
It's like I said, I'm grateful every day that I made this choice to pursue this field of medicine. I think at the time that I made it, when I was in my mid 20s, I I felt again kind of intuitively drawn to the field. Like I
Mhm.
thought it would be a good fit for my personality. It's relational. And I
Mhm.
have, again, maybe not as beautifully as you describe that relational the psychology in that
Mhm.
way, but I've always valued kind of relational, like relationships that are kind of deep and meaningful
Mhm.
versus transactional.
Yeah.
And in medicine, unfortunately, I think there really are fields in medicine that are just very black and white, very cut and dry.
Mhm.
And that's probably how we need them to be,
Mhm.
to be efficient and to be to allow our the medical system to function the way it does. But I think I truly believe I was drawn to this field in medicine because it's so relational. And and I think I made the decision unknowing how much I would enjoy this profession. But since making the choice and kind of finishing off the training, which it was a long haul, but worth it, because I remember thinking as I was finishing up my fellowship, I really hope I like this, because I am super specialized to do this one little thing. And if I don't like it,
Yes.
how disappointing for the years that I've invested in this. And but not for a second. I don't think I will work a day in my life.
Yeah.
It's a, I just love what I do,
Well,
and
yeah,
I think it's
it's your calling, and I also think that I'd like to give you some credit for making it that. And part of that is you, because you've brought your whole self to it. When people just bring their head to something and they're just doing it from a clinical, that what you do, there might be a lot of doctors that actually don't like what they're doing because their actual heart is not in it. So that really speaks to you and how you are doing your work with people.
I love that. And it's so funny, Patty, that you mentioned that. I talk about bird walking, but I read a little meditation book every morning or evening, kind of depending on the time of day that I open it up. But last night's message was about moving away from the head and really listening to your heart. And that the heart is what connects us to God and to the universe and to other people, and how important it is to really
Mhm.
move in that direction. And while the head is important
Mhm.
in practical matters, ultimately it's the heart that is the most valuable.
Yeah. And actually, through the heart is really where the mind can do its magic and do really amazing things. And you're living that, right? So I love that. I just wanted to kind of speak that
Yes.
because it isn't necessarily that you even chose well. You chose, and my sense is you probably would, no matter what you chose, this is you. This is how you live. This is how you are happy. And I think that's important to acknowledge. Even that. So you mentioned, I'm a mindfulness teacher, of course, and so doing those little readings, how powerful they can be to keep reminding us,
Mm-hmm.
okay, about these things. And I so much of what you said about how people go online, and I want to speak to this sort of like always this interesting kind of both and, because
Mm-hmm.
how in some ways information can become now an obstacle. Now I have this information, particularly with people who read and then they make up their mind. Oh, that's what it is. Okay. Or, oh my God, that's what it's going to be. And this idea that no, this is so complex. And the value of both getting information, because I think that there are people, actually doctors, that I don't necessarily trust to be, really, really, really guiding people, because they might jump right to, okay, let's do this IVF.
Yes.
And whoa, slow down. Like there's so much more here first. And so that ability, it's kind of what I trust with you. And you've actually sent people that I've sent to you and said, nope, you just go home, relax, and you keep trying. And now they have 2 babies. Okay. And I mean, they just popped in my head, and thank you,
I
thank you,
am.
thank you. Okay. So that sense of like that you truly are with that person and you're looking at it holistically. Okay.
Mm-hmm.
And how, as much as we can read so much information about it, that is not really, the computer cannot, not yet anyway. I know Chat GPT is really learning us. Okay.
Mm-hmm. Mm-hmm.
It's pretty amazing, right? But it's definitely not quite up to the level of being you and capable of holding all of that and guiding someone. So, one of the things I also really wanted to kind of touch on today, because there is so much, but from an attachment perspective, when I think about the women that I have worked with and the dealing with, first of all, the loss and the grief, because I feel like women who are not doing that, right, who aren't able to, or aware, or they're really focused on the goal,
Mm-hmm.
and they don't really give any time and space to be able to grieve a lost pregnancy, and how that how that impacts them. And do you see that? I mean, are you aware? Do patients say no, when they lost a pregnancy, do they come in and share like, this is what we did and yada, 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 and we're ready to try again? Or people who might come in and say, no, okay, we're ready, like just move on. Do you get a sense of that?
I do. I think it's obviously very situation dependent,
Mm-hmm.
kind of where the loss came from, when it happened, like how far along in the pregnancy. I think that significantly impacts people's grieving time. But I will tell you, when a patient loses a pregnancy under my care, um, usually it's early, it's within the first trimester, because after that they're sent to their OBGYNs for continuation of care.
Okay.
So I see them very early, but I really try to encourage patients to grieve the loss.
Mhm.
It's not just, you lost a 6 week pregnancy. Big picture, that's not a very long period of time. But what I reflect on often with patients is, hey, the moment I called and told you had a positive pregnancy test, you can't help but fast forward 9 months to day of delivery, and then what your life's going to look like when that baby turns 1 or 5, or gosh, when my baby's going to college. And
Mhm.
like, I think very quickly, just knowing you are pregnant, you've created a life with this child.
Yeah.
And there has to be a little bit of space and time to honor that loss. Otherwise, I fear, and again, I'm not a psychologist, I
Mhm.
don't know, but I feel like it's going to come back in some way.
Yeah.
And uh, when or where or how, I don't know, but I'm concerned when they don't acknowledge how meaningful just that very early pregnancy is,
Yeah.
both the male and the female, because I have also in my practice seen couples who have gone through loss, and I see a lot of like animosity between the couples start to
Mhm.
develop, and irritation and resentment. I mean, just again,
Yeah.
in the little bits of time I'm spending with them, and I worry it's because they're not allowing space to feel it,
Yeah.
talk about it, honor it, and then move on. And it doesn't mean that I'm delaying treatment or I'm delaying,
Yeah.
we're still kind of, again, we're following recommendations, guidelines, making sure that, all kind of the medical care is done properly in the right order and completed before we move on. But it's even that, I think, also contributes to the healing. Hey, let's do this bit of work up and that, and we'll kind of move forward. But just again, reminding them that it's okay to feel it, and to just, and you and I were chatting earlier before we jumped into this and started recording, just about kind of how, life, our own personal lives as professionals, some can impact what we bring to the table,
Mhm.
and maybe how we see patients. And I'm a mom of three, as you
Mhm.
know. But before I had my first son, I my my ex-husband and we had infertility issues and underwent the process of IVF. And again, I knew this is what the path I was on, but I didn't realize that I also was going to suffer from
Mhm.
infertility.
Yeah.
But our first pregnancy ended in a loss.
Mhm.
And I will often share that story with patients because I can, in a moment, be brought back to that day where at 6 weeks and change,
Mhm.
there was no longer a heartbeat where it once was. And the overwhelming sadness, yeah, that I felt. And I share that with patients because it never goes away.
Yeah.
And, but I felt it then, and I allowed myself to sit in that space. And I remember, those sleepless nights with an infant. I welcome them all. Like, I give it to me. I will get up 5 times a night because I have
Mhm.
this beautiful baby that's mine, and I can,
Yeah.
and you cherish it even more. Sometimes having those experiences,
Mhm.
um, and I just try to, like I said, allow patients to feel it all, because it's beautiful. It's sad, but it's also beautiful at the same time. If that makes sense.
Yes, it certainly does. Definitely to me, because I feel like, even if something is sad, heartbreaking, some of the biggest challenges in our life can be like these times where we actually woke up to life. And you spoke about, sometimes the gift of having lost a child is that ability to actually cherish life and cherish a child that is born and keeping you up all night,
Mhm.
how it shifts us and changes us for
Mhm.
sure so much. And I think you even spoke, thank you for sharing that story with us, and how that must have also, how that you bring that in
Mhm.
just in your experience, and how that really supports your ability to be with people in that process, because you have gone through it, but you've also dealt with the feelings, meaning you can be okay with their feelings. Yeah, that's beautiful.
Yeah,
Beautiful,
it is.
beautiful. Again, a whole nother, I could go off and just really stay on that topic, because it's a big one. And earlier, if people had listened, we talked with someone who does a lot of prenatal maternal mental health and grief work for women. And I'm curious that, that is obviously a curiosity of mine, always with doctors, by the way, not just infertility or
Mhm.
fertility docs, but with most doctors that I'm engaged with. I am always curious about how they support someone beyond their hour, and how might they encourage them to get support. Are you assessing their level of support? Is that part of like your questioning? Like, obviously you can see it with the couple. If there's
Mhm.
someone there with them, you can almost, get a sense of how supportive it is. But beyond that, is that something that you'll ask or
You know,
inquire about?
I do, but probably not enough. Like, even in hearing this conversation, I'm this conversation is wonderful because it's just giving me even more to go back in my practice and add to my practice. But I think it's kind of depending on how well I know the patients. I mean,
Mhm.
sometimes I'm working with patients, it can be very short. They come to me, they do a workup, you know, and they're pregnant a month or two later.
Yeah.
Or patients who we've been really working for extended time. And now maybe those patients, I know their mom because they've come into visits, and
Mhm.
I know that they have family in town, or I kind of know them more in depth. And
Mhm.
I think my tendency is in those situations, like, oh, will your mom be with you? Or who's going to be at home? Okay, you can expect this. He works overnights. Do you have someone who can come in? I think,
Yeah.
but I think I can do better with patients even that I don't know as deeply.
Yeah.
Um, and ask those questions. I mean, I think I ask the questions in situations where I know a little bit more about them, but
Yeah.
you bring up a very good point, just that having that emotional support,
Mhm.
hugely important. Again, I see the partners coming in,
Mhm.
um, but whether or not, what they have beyond that, because even in that situation, like the woman is hurting most of the time, very emotional. And so the male almost, or the partner, whether it's a same sex relationship or it's
Mhm.
that partner, is almost on some level expected to rise,
Yeah.
suppress their grief to support their
Mhm.
partner. And that's where, it's, again, I think they really both need to have the space to grieve.
Yeah.
And that shared grief again, in my mind, could be the impetus of bringing them closer and a bonding experience if they allow it. But
Yeah.
too often, I think that the partner tends to try to be the the steady, the support, the rock.
Right.
um
Right.
but
Which
I'd
does
like to see
mean,
it more. I'd like
yeah.
more feelings from both. I think it would be
Yeah, I
better.
think again, it's this sort of both and where, it's remarkable. Even, I reflect on my own marital relationship and I'm aware of it. And it's really cool to see over the years together how we, without words, are often, rebalancing things for each other. If he's struggling, I am stepping up in some way. And then there are times if I'm struggling, he's stepping up. And that is a natural thing. There's
Mhm.
nothing wrong with it. And I think in our culture, women will tend to get more support
Mhm.
because women, first of all, tend to know more. Okay, women, I imagine, share more with
Mhm.
other people that they're going through this. Not always. Some people keep it very much close to the vest and private. But women definitely share more than probably men about going through any kind of infertility, and then this process. And so, if women know, then women know when there's a loss. And so
Mhm.
there's just more opportunity, kind of, I think, for women to get support, whereas men might suffer more in silence and need to keep being that rock. So I see that as a real area that we could definitely improve a bit,
Mhm. Mhm.
in honoring that and again, how men grieve can be different as well.
Of
So they
course.
don't have to cry. Okay.
Mhm.
That's not the only way that people grieve or process grief. So yeah, we can chat on the side because I have some ideas.
Yes, good,
Okay.
great.
Yes.
Look forward to it.
Yeah, I love it. And again, honoring that there is only so much time. And I
Mhm.
think that, sometimes we do what we have to do and we want to do more.
Mhm.
Um and I think that, even as a psychologist, I mean, I cannot do everything with
Mhm.
everyone. And I think that's where working, even as expanding a team, which sometimes you and I have talked about, is really about this, having a more of like that tribal kind of
Mhm.
thing where there's like, when I think of women, of course, women have more like supportive tribes. Men have these like kind of tribes,
Sure.
where they're like, football, let's get together and watch. And a lot happens because my husband has his little tribe, and boy, oh boy, are those boys, they're adorable.
Mhm.
And I certainly know that my husband and I also went through losing our first child, and his boys really came to, support him. And I've watched them show up in his life at all kinds of different times where he's needed it. So men do show up for men. I think it's really, really cool. It might look a little bit different than
Yes.
women, but it's needed. And I think it's needed around this. And it does concern me sometimes because I do think that men probably keep it, on the hush hush a lot. So that means that they're cut off from really that support from people who would support them if they were open. Yeah,
Sure.
yeah. So just a plug for guys to find those outlets or even share, because then they can get support. I'm trying to think. I mean, there's so much more. I certainly always have like a list of so many things that I wanted to cover, and I certainly know we didn't. But when you think, about what we've talked about, maybe anything that you're like, wow, I really, really wanted to touch on something else. Is there anything?
I was thinking, Patty, you and I had chatted before about kind of the impact of that infertility, the impact that infertility has on stress, and almost presenting as a post-traumatic stress situation
Yeah.
on couples. I'm curious the impact that that has on their ability to attach to their baby.
Mhm.
I often, when I graduate a patient and send them on to their OB, my parting words always are I always say to them, I hope, my hope is that you can go on and enjoy this pregnancy and just sink into every bit of it because you work so hard for it.
Yeah.
And especially those patients that I feel like they present to me in a very fear forward way.
Mhm.
I'm oftentimes just reminding them that this is a gift at this point, that everything looks good, and trying to provide them with as much reassurance as I can in medicine. Of course, nothing's
Yeah.
100%, but things look great. Now go on and enjoy that pregnancy. Um, but I fear myself that a lot of these patients are not able to relax and enjoy it. And
Yeah.
maybe you can speak to that.
I mean, I definitely see that. This isn't my specialty, but trauma is. So I will see people with lots of other trauma, and certainly the trauma of loss around losing children and the impact, whether it's losing a pregnancy and or losing an infant at any point during the pregnancy or postpartum, and the impact that that has on their level of kind of fear and what happens when people are afraid. So we can just imagine a woman, right, who is already fearful, right, a fearful, anxious person who now is pregnant, and how they cope with that, right? They might just in some ways try to shut down, okay? And so that shutdown might look like, don't get attached because I might lose this baby,
Mhm.
right? So this sense of like not allowing themselves, like you said, to enjoy it.
Mhm.
Now, and in fact, we might see those people as their pregnancy being really terrible, and
Mhm.
them being like, "Oh my God, this is awful," and having a hard time with it. Okay, or just white knuckling it through it. So there might be that tendency to sort of carry that in different kinds of ways, or anxious and worried about every little thing that happens
Mhm.
throughout. Okay, whether the baby's moving or moving too much or not moving enough, and how that sort of anxiety kind of imprints. And there is, I mean, we're not going to go into it today, but there's definitely more and more data that keeps getting like earlier and earlier about the impact of maternal stress, and of course external, because whatever is external, okay, is going to then be internalized, because we can't, if we're living in a system that's super stressed out. And I think there's a lot, I mean, you see it really up close and personal, the stress that's involved with this process of, we'll start with just the financial. Like it's a huge financial stressor for couples. That's huge. And then second of all, I mean, all the injections and what that does to the woman, and then their emotions, and
Mhm.
the whole, there's so much to that. And so that is stressful, and the need to really manage that stress and manage those emotions, that would be the ideal, is couples having real support with that, because it does affect, I mean, their physical well-being, but then of course everything that affects the physical well-being is impacting the growing little baby inside.
Mhm.
Whether we like to, I mean, I know that people are like, oh, this won't hurt the baby, as they drink a beer or something, right? Like, oh, beer won't hurt the baby, right? And I mean, I hear these things all the time out in the world. Okay.
Sure. Sure.
We once had, we went for a boat ride, and, someone's like, oh no, you can't go on the boat, because, the bump on the boat might hurt the baby, right? And so those kinds of like beliefs of what will and won't hurt the baby,
Sure.
But psychological stress and things like that, people have no idea.
Yeah.
That is a real challenge, and it does impact a growing fetus. It does. We know that. We know that now.
Mm-hmm.
I love that you send them off with that wish,
Mm-hmm.
and maybe we'll send them off with a wish and some resources.
I
Okay.
was going to say I'm more and more like I feel like we've chatted about it, the importance of getting patients into counseling
Mhm.
through the process. And I think certain patients are more open to it. I just feel that they
Yeah.
are, and right away we'll make a recommendation or a referral. Others are, I can tell, are a little bit more closed off, but we can work on this again on the
I
side, but
love it. We're
like
birthing something right now.
yes, and just being able to provide them with that at maybe at the initial visit, and then also in their farewell package, just a reminder that this process wasn't easy, and
Yeah.
it they may feel they if they are open to it, they may, I would encourage them to talk it through, and
Yeah.
no time like the present to just settle into these feelings, these emotions, so they
Mhm.
don't, so that they have the best pregnancy and just can enjoy it, enjoy their hard work, their
Yeah.
just the all of the investments. I tell patients they invest in so many ways in this process, financially, emotionally, their time,
Yeah.
and even in their relationship, and getting back to that, another something I again try to remind patients, like, what brought them here in the first place. They want to grow a family with this person that they love.
Yeah.
Let's not lose sight of that,
Mhm.
because everything that I do in my clinic is elective, but this relationship should be that, the main point,
Yeah.
the trunk of the tree.
Yep.
And let's make sure we allow that to be healthy and grow and flourish in the process.
Yep. I love it.
Yeah.
Yep. Well, I think that, we'll let this podcast be sort of a birthing place for us to maybe collab and do some cool things to support
Yes.
people, because that's really what this podcast, I know Lizzie wasn't able to join us today, and she's super sad about that because she would have liked this as well. And just knowing that our whole intention of doing this, the Bonded podcast, is ultimately to support people, right, in stronger attachments. And how do we do that? We build community, we build connection. And that you are every single day working with people who need support and
Mhm.
connection, and need to know that actually they don't even know this. But you and I talked earlier about how a group of people, and we'll end with this idea, because sometimes people will want to again keep it real close in, maybe they go to therapy, but the process of this being literally held in the arms of a group, what that does, that container, it can hold anything, and it literally allows them to be able, one, to feel I'm not alone. Second, to actually not carry it anymore as a burden. It's actually a sort of shared experience, and people have no idea the transformation and the power of a group experience. So I think that's what I'm thinking of, how
Yes.
we
Yes.
support people.
Yes. 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 I
Yay!
couldn't agree more.
Awesome. Well,
Wonderful.
I thank you so much. It was such a joy and pleasure to be with you today.
Me
And
too.
anytime, I look forward to our next chat.
Yes. Me too. Me too. Have a
Okay.
wonderful day. And thank you so much for including me in Bonded Podcast. And I'd love to chat more about all these
Beautiful.
things.
All right. To be continued then.
Have a
Okay.
great day.
You too. Bye bye.
Bye.
Thank you for tuning in to this week's episode. If it spoke to you, it'll probably speak to someone you love too. Share it with a friend and leave us a 5-star review to help spread the message it's never too late to heal.